Hi everybody, my name is Rhys Barber. I'm the audiologist here at Audiology Associates. We upload new earwax removal videos every Monday, Wednesday and Friday at 9 PM UK time, so please consider subscribing. Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our compilation video today. So we have two patients in this compilation. Both have kind of dry wax issues, but very different in nature. So this first gentleman's come through with some very reduced hearing in both sides. He's quite a regular patient of ours. He suffers with very dry skin, so his wax tends to be very dry also. But what you can see is this dry wax is very hard, but it's actually formed in layers or plates. So as we're taking this away, you'll see as it gets sucked into there. The gentleman's been using a lot of olive oil, so it means that he's managed to keep this really soft based on past experience. He finds that more helpful. But we've got these large chunks of dry wax that have formed in here, but formed in separate layers, you see, in the center of the canal. There's a little bit around the outside edge, so we've managed to remove all the larger chunks from this canal now. So just a little bit of tidying up around the edge here, just to take those bits away. You can see the drier skin there lifting from the side of the canal wall, just taking away some of the drier wax from the ceiling of the ear canal, the kind of the attic portion of the canal, if you like. So we're just taking that away there. Just lifting some of the looser bits from the outer part of the canal. There we go. Lovely. We can see the eardrum already, so you can see it's all looking nice and shiny in there. We'll get a good look at that now in a second. There we are. So there's the eardrum, all looking healthy. So this is the same patient with the second ear. You can see much more clearly in here the individual blocks of dry wax that have formed. If the patient hadn't oiled this before they come through, it would have been a little bit more difficult to take away. The majority of cases, we don't need olive oil to carry out the suction beforehand. But in this case, with the very dry chunks like this, patient finds it a lot more comfortable if they've oiled it beforehand, which is absolutely fine. Doesn't affect us at all. So just going in, taking individual pieces away. This looks like a much larger section here. There we are. Just getting a grip to maneuver it and just bend it slightly so we can get out of the canal. A little bit of loose dry wax and skin here at the top, so we're just going to take that away. There we go. Let's take those few pieces away there. Little flaps of dry skin here. Because we use the olive oil, the dry flaps of skin have actually started to moisten a little bit, start to moisturize just ever so slightly. So they're peeling away really nicely. If these were, say, longer, drier pieces of skin or much harder pieces of skin, as we go in, it would actually lift and it could run the risk of bleeding in the canal. So happy enough to take those away there. This is what we removed. So you can see it 5 centimeters there, 2 inches. In between both ears, so all come away nicely. This is our second patient in the compilation. This patient's been through to see us before as well. Suffers with the same kind of problem every time. We have this very dry, thin layers of earwax that form around the canal, but also over the drum itself. So they start to notice having a few issues as far as the hearing is concerned. We come in about every 12 months to get this done. So what we're doing here is starting with the suction tube on the outside edge, lifting here to try and get a good leading edge underneath this so we can start to peel it away a little bit more effectively. So you can see just lifting that there, working our way slowly along the canal wall. Because we've got a leading edge and we're going to go in with a crocodile forceps. Sometimes with these kind of skin peels, it's difficult to get these away. Sometimes it'll come away like this one is in pieces. There are a few of our videos where they come away in one piece, which is obviously really satisfying when it comes out in one go. But most of the time it's this kind of issue here where you get this smaller pieces breaking away. So lifting again with a crocodile forceps. There we are, just pulling away there. When you've got the crocodile forceps in the ear as well, it's slightly bigger than the suction tube. So you have to work slightly further back away from it sometimes if the canal is not particularly big, which is what it is in this case, which is why it gets a little bit fuzzy at times, because you have to keep the camera a bit further back. It's just in front of those little cilla, those smaller hairs on the inner part of the ear. Those hairs are tiny. They're very fine, thin, teeny tiny little hairs. So you couldn't trim those away, but now you can see we can go in that little bit deeper now. So we get a clearer view. Got a nice grip on a section of wax there, but it's torn away again. Now we can start to see the layer that's built up over the eardrum there. So that's to the right side of the screen. And we've got a hard bit of wax at the top there. So what we're going to do is work on that harder piece first to peel downwards, because we're going to have to be very gentle in taking this away. There we are. Now we're starting to see it peel away. And again, just lifting ever so slightly. So what we're doing is using the suction to hold on to it, pulling downwards and also withdrawing the suction tube slightly at the same time, just to try and keep everything coming away and moving nicely. So there we are. You can just start to see the leading edge of the eardrum there. So just going in with the crocodile forceps now to get a grip on that top section, and hopefully the whole thing will come away. There we go. So that's completely uncovered the eardrum now. So we should see a lovely eardrum. There we are. We have still got some dry wax around the outside edge here, just on the ridge that appears just before the eardrum. Most people have this kind of little ridge that appears just before the eardrum, which means you have a little valley that's tucked in behind. So what we've got now is that dry wax is sitting down in that valley and on top of that ridge. So we need to just gently peel this away. So you can imagine this is quite delicate because we don't want to get too close to the eardrum, but we also have to have enough room to be able to maneuver, there we are, this wax away from the sides of the canal walls and out of the valley. There you go, starting to come away now. Just crocodile forceps going in. If we can just get a grip on this section here, just got a grip on the leading edge. Just pulling, there we go, taking quite a big chunk there. There's still a little strand there that's sitting up, so we're going to use the forceps again just to get a grip on the edge of that. There you go, that's that piece taken away as well. We've just got the bottom section to the right now to take away. Managing to lift it, there we are. Oh, looks like it might break. There you go, and that's a good peel there, coming away from that valley around the edge. There we are, lovely. And we have a lovely shiny eardrum. So this is what we removed. So you can see the section here around about the 3 centimeter mark was the piece that was completely covering the eardrum. And same there for the section around about the 1 inch mark. And there we go, guys. Thank you very much for watching our video today. If you did enjoy the video, then please like. If you're not subscribed already and you'd like to do so, you can click the subscribe button here. If you'd like to check out some more of our videos, they're also up there. Now, if you want to follow us, you can do on Facebook, Twitter, Instagram, and also check our website if you want to know a little bit more about us. As always, guys, until the next time, take care.